that drives me crazy personally. Remember, don't forget, the gray ramus and the white ramus, they really are important. Parasympathetic signals come out, they bypass the RAMI because they're not going to the sympathetic chain, and they go to a target ganglion somewhere. So we looked at and talked about how these signals get to all of these various organs. Remember, you have to know the plexes involved. You have to know the ganglia involved, because there are a bunch of ganglia sitting out and about. So please remember those. I don't have the slide with me, sorry. The difference in getting the signals to the target. All right. So, this, what would you call this? A somatic signal? Okay. Heavily myelinated. It's neurotransmitter. Acetylcholine. So what did I just draw? Parasympathetic. Preganglionic axon, lightly myelinated. Postganglionic, unmyelinated. Sympathetic, lightly myelinated, unmyelinated, acetylcholine, norepinephrine, with our one exception, remember? What's it innervate? What?
Adrenal medulla.
The adrenal medulla. What does that release? Norepi and epi. Thank you. So you know all this. Cool. The tough part is remembering the plexes and remembering the ganglia. All right? Yes?
It doesn't have middle cervical.
No, this is a simplified overview.
Yeah, because
Yeah,
you're
no.
supposed to know the middle one.
No, yeah, you're supposed to know those three that are sitting up there. Okay? Yes, this is the simplified view. There is a more complex view in the slide set that I used earlier. I forgot to add it. I realized as I'm looking at it, it's missing. So. Once again, I don't anticipate I'm going to ask you a question on what does this mean. Instead, I will use terminology. It's important that you know the terminology. You know, what is hemiparesis, hemiplegia, paralysis, a palsy, paraplegia, monoparesis, quadriplegia, what are these things? Okay? And went through and started presenting some topics to you. We started to look at some of these. The cord syndromes and cauda equina syndrome are pretty well defined in your textbooks. Syringomyelia is this fluid-filled space that you end up with myelitis, an infection or inflammation, typically of the myelin, but it doesn't, typically it's myelin, but it could be the axon. Infarction, in general, infarctions are loss of oxygenation. So you're gonna have a non-oxygenated area. Sorry.
Gum.
I had no idea. Sorry I touched it.
I have help.
Bell's palsy with facial nerve, one that you're going to be confronted with in your careers. Cerebral palsy, we talked about once again. Mostly infections involved with pregnancy. Can be due to cerebral hemorrhage, can be due to trauma prior to birth or at birth. So, and then these. Oh yes. I think we're going to spend more time on these figures today than everything else combined. All right. Pure hemiparesis. There it is. Yep. This is only involving the internal capsule down to the superior surface of the pons. It is only going to affect the lower face and below. A lot of times this will be reduced function versus complete loss of function. When we talk about hemiparesis with additional defects, we're usually referring to a loss of function. Bleed in the internal capsule, middle cerebral artery, anterior choroidal arteries can affect those areas. Pons bleed, basilar artery, pontine branches. It is the pontine branches of the basilar artery. That's the way. Right? If you really have a basilar bleed, you're going to drop. You're going to go down pretty fast. Demyelination, tumors, abscess, whatever. All right? We're okay with this? Additional defects, arterial blockage and hemorrhage, head trauma. Herniation would be taking place down here. Typically, if you are going to herniate, you're going to do massive damage. The damages would be more than just
So there's going to be swelling though, so that's you're going to damage more than just at that upper pons location, right?
well, no, you can herniate, the herniation has to be above the pons.
But if there's swelling, that's going to be pressing on different areas.
Well, you don't have to have swelling with herniation. Herniation technically means to push through something.
Okay.
So where you're going to end up with the swelling is over here. So you might be pushing out a piece of your brain through the meningeal layer. Does that make more sense?
Yes.
Okay.
No.
Okay. So, and obviously, the minute you include the cortex in here, you're probably talking loss of function. Hemiparesis sparing the face. You must understand how this branch comes off here. If you don't understand that, say something now. Because what you're not seeing is that coming from this side, we have the branch coming down from the face, and we have a branch coming this way and two going that way. It's the branch from this side that is providing the innervation. You really have to understand what's going on with that, the branching there, okay? Oh, and then, so we can have cortical problems, and we can have problems below the pons to the cervical enlargement. It will not be below the cervical enlargement. If it's below the cervical enlargement, you're going to spare the upper body. So it can only be this far. The only way to get the upper body as well. So if it's too low here, you spare the upper part and you lose that. Does that make some sense? Okay. Unilateral, face and arm. Only way you can have this, cortical. You can make the argument that it could be deep cortical, but it's cortical. Okay, this is still cortical here. It can't be in through here because the fiber tracks are too close together. If you lose the face and arm, you can also lose the legs. Abscesses. Brain abscesses typically come about as the result of either some penetrating trauma where the infection was missed, an infection of some sort that made it to your brain. But yeah. One arm could be one leg as well. Okay? I mean, there's really no reason that we couldn't knock out the leg over here and have just one leg be gone as well. Peripheral nerve, pretty obvious, or discrete damage in the brain. So, there you go. I don't know what else to say about that. Small tumor, abscess, trauma, diabetic neuropathy. Diabetic neuropathy is going to affect the peripheral nerve, as will some sort of injury. These affect the cortex. Monoparesis of the leg. Crural means leg, brachial means arm. Has to be below the cervical enlargement or in the cortex. So these are pretty, I think, after having gone through the somatosensory stuff, you should find this to be pretty easy at this point. Facial weakness. Yeah, facial weakness. What's going to happen here? Bell's palsy, trauma, some form of, yeah.
So in this picture, the face from the other side of the brain, that part and the palm is being affected too, right? Another side of the brain, the whole face.
So in this, only half the face is being affected.
But it's the top part as well.
The whole thing.
Okay.
Okay? And there's a good reason for that. The problem is in the nerves leading to the face. The problem is after the signal is leaving the pons. So let's see if I can